Hi, my name is Dr. Waqas Gaba. I'm one of the consultant gastroenterologists and hepatologists. I have been working as a consultant in NHS as well as private sector currently. I have in total of medical experience of practicing medicine for over 15 years now. Uh, and I see a variety of gastroenterology and hepatology conditions, including everything to do with your digestive health, your nutrition, hepatology, liver, and especially focusing my interest on abdominal bloating, irritable bowel syndrome, fatty liver, and anything to do with your inflammatory bowel disease and related subjects. So I think when I look at gastroenterology specialty, well, I'm a bit biased as well, you can imagine that, but I love the variety and the spectrum of things you can do. And for example, starting from something which is common like abdominal pain, but it's how much of that can create an impact on the quality of life of the patients, and how can you make a difference. So why I chose the specialty, there are two folds. One, due to the variety of problems you can see, and the other thing is that the satisfaction and the amount of difference you can make in the life of your patients. Um Even small advice, one consultation, one telephone call, or remote consultation with my patients when explaining them about these things can make a huge difference. So one aspect is the variety of the conditions you can see. The other thing is that the difference you can make in the patient's life. I think I have uh, noted that the people keep coming back to me, and the feedback which I have formally and informally keep get quite a lot is that I am very realistic, pragmatic, and I listen to the patients. I do not rush things. My philosophy of practice is, whether I'm in NHS clinic or in my private practice, is that I do not rush anybody. We are not, I do not do a practice like a conveyor belt. See, my practice is patient focused. I take my time. We go through all those things. Whoever comes to see me, and this is a repeated ongoing thing with me and my patients, is that I take time, we go through everything. And most importantly, my all plans are shared decision making. I never just make a plan and just let the patient go. My plans are always, I normally tend to just put all the cards on the table. We discuss what are the options are and what should be the next most appropriate step to go, how much we can achieve in this consultation, what should we do, what the realistic outcome should be, and what are the expectations from my patients are. And then we go through all those things in a stepwise fashion, what we know, what we can achieve, what investigations we know. And then this is the outcome, and this is the feedback I keep getting from my patients again and again, that I take things slowly, stepwise, and do the consultations quite thoroughly. Again, I think, as I mentioned previously, that helping patients who have suffered for years before without a diagnosis, I probably class that three sectors or three folds. The rewards. One is that making a diagnosis of something which the patient have been suffering and being in the system for years, making a diagnosis and reassuring them. Number two, treating them in a way that helps their symptoms and change their life forever sometimes, in a good way. Number three, sometimes excluding something more sinister like cancers, or picking them on earlier stages so that appropriately treating them can really make a difference in their quality of life and a normal lifespan as well. So that is the most rewarding part of it.